Well, to find out more about how people are treated in rehab, we're joined by Dr. Shimi Kang, an addiction specialist and psychiatrist here in Vancouver. A lot of us, when we heard that Rob Ford had told a columnist that rehab's amazing, we were kind of surprised at that reaction. What about you?
Well, mixed feelings. On one hand, it's great. He's there. He's finally getting treatment and he's enjoying it, or he's finding some benefit to it. On the other hand, as a psychiatrist, I've worked with hundreds of people with addiction over 10 years, and I hear that with a bit of caution. I worry he's in the honeymoon phase of recovery, that, 30 days and my life will be better. And addiction isn't an on-off switch. It's a chronic disease. It takes time, and it takes a lot of constant effort.
What is it, based on your experience? Obviously, we don't know what Rob Ford is going through, but in those first few days that would lead somebody to feel things are amazing?
Well, there's a lot of support, definitely that. He's away from maybe this pressures and stress of his other life. Maybe he's getting some sleep finally. A brain that's been exposed to substances every day, on and on, needs time to heal, and that's going to take time for those neurons to literally reconnect. And you can have a feeling of, wow, this is great. I'm finally getting some recovery.
In my many years of reporting here in Vancouver, I spent some time on the downtown east side. I used to run into people who would finally decide to go into rehab, get a chance to go in, come out of it, and then be smoking crack the next day. What is that pull back into the old life even after a successful rehab stint? How powerful is that?
Addiction's a serious illness, and this case has the hallmarks of the serious aspects of it. There's loss of control, out of consequences, and what you mentioned really shows how serious it is. And rehab is the beginning of treatment. It is not treatment. Real treatment is when you're living in your community, doing your regular activities, and you're being triggered by all the things that give you the idea to use, and you're able to maintain sobriety. And that is actual treatment. And when someone has had a year of sobriety, let's say in a case like this, in their own homes and community, then we start to feel very optimistic.
And are you surprised at all that he apparently has access to a phone, maybe has his own cell phone while in rehab?
It's unusual. The point is to not have distractions and to be able to focus on healing and health and sleeping and not be distracted by things that might happen or text messages on a phone. So that's a bit unusual.
I know, obviously, he's not your patient, you're not his doctor, but given your experience and what, like me, you've seen from afar in the media, any sense of how long he would need to be in rehab?
Well, the disease of addiction usually begins in adolescence or early adulthood. And when a brain's been exposed to substances for decades, it really does take a long time to recover. Now, with aggressive treatment, with good treatment, I've seen cases when people are ready that they really come out of treatment with a new view on life. Others, it's a constant struggle. It can take decades. So I'm hopeful, I'm optimistic he's in the right place, but I'm cautious given his history.
All right, always so nice to talk to you. Thank you very much.
Thank you.